and mom. Today we have a special guest with us. She is Dr. Mrs. Isa. She's a child and adolescent mental health expert, and the best part of it, she's the president, Medical Women Association of Nigeria, of which I'm a member. Welcome to the program, Dr. Isa. We're happy to have you.
Thank you very much for having me.
Okay. Today's topic is on mental and psychological changes in adolescence. And luckily for us, we have an expert in the house that's going to be talking about it. So we will start. The first question, just go through the questions. And the first question is, Dr. Isa, who is an adolescent?
Okay. An adolescent is one who is between the age of 10 years to 19 years. That's according to WHO. And there are different groups in the adolescent. There's the early one, the middle adolescents, and the late adolescents. So the early adolescents are those between 10 to 12, and the middle adolescents are those from 12 to 14, and then 14 to 19, and the late adolescents.
Okay, so the next question for Dr. Isa is, what are the mental and psychological changes that occur during adolescence?
Yes, there's a lot of mental and psychological changes that occur in adolescence. One of them is that adolescents can go moody. So when I say moody, their mood just changes. 1 minute they are sad, the other minute they are happy. Their mood is just fluctuating, and they really can't even understand why that is going on. Another thing is that they easily get bored. So they are doing this thing and they say, no, I'm tired of doing this, I want to do this other thing. And then they can easily get irritable. So irritable is like being prone to anger.
Okay.
And then they can be impulsive. When I say impulsive, they can just take an action without thinking about the consequences of the action. And they can also have poor direction and poor decision making. So most adolescents, they tell me that I can't take a decision, I'm indecisive. I cannot take a decision, even though I want to do this, I want to do this at the same time, but I don't know which one to do. And there are times that adolescents may want to keep to themselves. They just like to be alone. They want to stay on their own. They don't want anybody to interrupt with them or talk with them. And then there's one thing that usually happens in adolescents, especially in the younger adolescents. They have a fantasy world, and they like to live in that their fantasy world. And then younger adolescents is very common among young adolescents. And this is usually related to their desires, their fears, and things that they see in their environment. That's why it's very important that we check what children watch, the kind of movies they watch, the interactions that they have with people. Is very important because that can be the theme of their fantasy world. And then they have this poor response to rejection. So when you reject them, or you say something, or you make critical comments about their person or their figure, their shape, their body, or anything about the way they look, they usually have a poor perception towards rejection and criticism.
Oh, thank you,
Yes.
Doctor. Talking about these mental changes, do boys and girls, I mean adolescent boys and girls, do they have the same mental changes, the same experience?
Actually, no, but they are similar, but not necessarily the same. And the changes that people have depends on how they perceive it, how they perceive their changes that are causing them, like physical changes that occur. There's usually a relationship between physical changes that occur. I know there was a time we talked about physical changes that occurs in females and physical changes that occurs in males. So the way they react towards it and the way they are prepared, preparation and reaction is a key towards how they will express the mental changes.
Okay, so how do they, these mental changes, how do they present? The signs, the symptoms, how do they present in our adolescent boys and girls?
Okay, and for boys that mature early, there's a different presentation. So when boys mature early, so you've seen these boys, they are tall, they have this muscular build, they usually are very, very proud of themselves because they are very popular. So they have very good high self-esteem, and people around them are looking at them as role models. And this can be a problem to these boys because they tend to be very popular, they tend to now want to do what adults are doing. And there's something very important I need to talk about. The development of the brain of the child, of the adolescent, is not fully developed. There's a part of the brain called the prefrontal cortex. That prefrontal cortex is not fully developed until an adolescent is 24 years old. So can you imagine that? So that's why people are arguing and saying why would we give them the status of being an adult when they are still developing in their brain? So many schools of thought are saying, let them increase the age of adolescent to 24, when we are not sure that their brain is not fully matured. Because at that age, when the prefrontal cortex, which is part of the brain that is found in the back of the forehead, is not fully developed, and that brain part is responsible for executive functioning, for judgment, for making decisions, for not being impulsive, all those things I said, that are the things that are causing them. So you can just look at it that it's not really their fault. It's the fact that that brain part is not developed fully. And then the part of the brain that is developed fully is called the amygdala. And that part of the brain is responsible for emotional reactions. So they become very emotional. They're not able to express themselves. You see girls and boys falling in and out of love. They are loving and loving and loving because the emotional part of their brain is very sensitive. It's now that part that is taking over most of the part of their brain and taking over decision making. And then, we're talking about the boys that mature early. I said that the advantage in sports, they have high self-esteem. So some of these boys, if not well taken care of, their academic performance may reduce. Okay. And they will not take, not able to make good decisions. They are not concentrating their academics and just becoming the popular boy in the campus and all in the school. Okay. Then those boys that mature late, you see boys that are small for their age, their other friends of their age are bigger than them. So they now become very shy. Okay. So those boys will now lose their self-esteem, and sometimes they want to use substances. You talked about substances. Yeah. Those boys want to use substances because they feel that it will help them to develop their muscles. So they're using steroids because they want to develop their muscular build and all that, and that also have complications. Yeah. So you see it like a vicious circle. So then for girls that mature early, it's also a problem. So you see girls that are 12 and they're looking like 17 or 18, and sometimes our parents don't also help. So a girl is 12 years old and she's using Bone Straight, and everybody's thinking she's 17, and then the boys or the other men are now making passes at her, they're trying to talk to her and asking her for a relationship, and they don't know or they don't believe that she's 12 years old. And at the end of the day, these girls can go into relationships which they're not ready for. Remember that I said that the emotional part of their brain is now very sensitive. So they're not able to take decisions and they're not prepared for societal demands on them. Okay. So they can even get unwanted pregnancies at teenage.
Okay. So Dr. Isa, what is responsible for this mental or psychological changes in adolescents? What is responsible?
Okay, the main thing that is really responsible is the hormonal changes. So during adolescence, we have increase in hormones. The females estrogen and progesterone, then for the males testosterone, increase in hormones. And then the prefrontal cortex that I talked about, the fact that it's not fully developed, and the fact that the amygdala, the emotional part of the brain, is fully developed. Those are the real reasons why all these changes take place.
Okay, all these changes you have talked about, how do adolescents perceive them? All these mental changes, how do they perceive them?
Most adolescents usually may perceive it okay, especially if they are prepared. So preparation is the key, yes, to the way they will perceive it. But when they are not prepared, they may not perceive it rightly, and they may now go into psychological stressors. It may be a stressor to them.
Okay. Then from your experience as a child and adolescent mental health expert, what are the common mental health disorders you have seen in adolescents?
Okay, in adolescents, substance use disorder is common amongst males, especially males. And then in females, depression is common amongst females. Then also we have adjustment disorder. We said it before that they have poor adaptation to change. So when you are changing from one situation to another, they may not be able to adjust. Maybe there's marital problems, their parents are separating, going through divorce. It may be a problem for them, and they may get into adjustment issues. Or maybe they are changing school, you are sending them to boarding house, they've been at home for all this time with you, and you are sending them to boarding house without them being prepared emotionally. It can be a stressor to them, and it can come down with some adjustment issues.
Okay, please. Talking about these changes, please tell us what adolescents should do about these mental changes you have been discussing. What should they do, and how to cope and all that?
I think education is key. So they should be aware that these changes can occur and that these changes are normal, and they should be able to go through these changes with a lot of support from caregivers, from their parents, from teachers too. Because I do a lot of training for teachers, because teachers may be the first caregiver to patients, to parents, to children at this age,
yes.
or adolescents at this age, especially if they're in boarding school, they live at
yes.
home. Yeah.
Okay. Then, Dr. Isa, final word for all the adorable adolescents out there concerning how they can protect their mental health.
Okay, I think that in our society, people just think that when you say mental health, you're talking about crazy. So it's very difficult for people to go to a counselor or to go to a psychologist to say, I think I want to talk to you about my mental health. Unlike in developed countries where people can just go up to a counselor and talk to them about the way they feel, about the way they are behaving and the changes that's occurring to them. So I want to say that these changes that occur in adolescence, they are normal changes.
Okay.
And we should talk about it more so that you'll be able to get help.
Okay.
Yes.
Thank you, Dr. Isa, so much
for
coming to share your experience with us, to talk about mental health, mental challenges in adolescents, how they perceive all these changes, and how they can cope about it. You know, like I said, this channel, The Adorable Adolescent, is dedicated to the well-being of adolescents. We want them to grow up to healthy, responsible, and successful adults. Thank you so much. We appreciate your time. So please, viewers out there, watch out for the next episode of The Adorable Adolescent as we tackle the issues and challenges of adolescents head on. In case there are other issues about mental and psychological change in adolescents that we did not address in the course of this lecture, please feel free, go to the comment section, drop your question. Dr. Isa will be ready anytime, any day to answer those questions, and I will relay the answers back to you. So please like our channel, subscribe and share. You know, it's all about the well-being of adolescents. We have children, we love them. That's why we are doing this program. Please subscribe, please like, please share, and tell others about it. So from us is bye.